Article 517 of the National Electrical Code addresses the electrical requirements for healthcare facilities. Part Roman II of Article 517 specifically deals with general care areas. The key question is whether Part Roman II applies to medical office buildings, doctors' offices, or dentist offices where patient care activities do not involve the use of electrical or electronic life support systems, or invasive procedures where patients are electrically connected to line-connected electromedical devices. The answer is no. Part Roman II of Article 517 does not apply to these types of facilities. However, it's important to understand the scope and requirements of Article 517 to ensure electrical safety in all healthcare settings. Article 517.1 provides the general scope, and it is important to note that the authority having jurisdiction, or OJ, has the final say in the interpretation and application of the code. Understanding the definitions provided in Article 517.2 is crucial. These definitions clarify the meaning of terms such as patient care areas, general care areas, and critical care areas. A patient care area is any portion of a healthcare facility wherein patients are intended to be examined or treated. General care areas are defined as patient care areas that do not meet the criteria for critical care areas or wet procedure locations. These areas include examination rooms, therapy areas, and similar spaces. Critical care areas, on the other hand, are those areas where patients are subjected to invasive procedures and connected to electrical life support equipment. These areas require more stringent electrical safety measures. Wet procedure locations are patient care areas that are normally subject to wet conditions while patients are present. This includes standing fluids on the floor or drenching of the work area, both of which are incidental to patient care, or extended periods of spills or water while patients are present. Article 517.10 covers wiring methods. It requires that all wiring in patient care areas comply with Chapter 3 of the NEC, with specific requirements for grounding and bonding. All branch circuits serving patient care areas must be provided with a ground fault circuit interrupter, or GFCI, protection. This requirement helps to protect patients and staff from electrical shock hazards. Article 517.11 addresses panel board requirements. Panel boards serving patient care areas must have a grounded neutral bus that is isolated from the panel board enclosure. This isolation helps to reduce the risk of stray currents that could cause electrical interference or shock hazards. Article 517.13 focuses on receptacle requirements in patient care areas. Receptacles must be hospital grade and identified with a green dot. These receptacles are designed to provide a more reliable connection and are tested to withstand higher levels of physical stress. Article 517.16 covers the essential electrical system, which is a backup power system that provides electricity during power outages. The essential electrical system is required for critical care areas and other areas where interruption of power could pose a threat to patient safety. The essential electrical system must have two independent power sources, a normal source and an alternate source. The normal source is typically the utility power supply, while the alternate source is usually a generator. Article 517.17 provides details on the life safety branch, which is a subset of the essential electrical system that provides power to critical life safety equipment such as exit lighting and fire alarm systems. Article 517.18 addresses the critical branch, which is another subset of the essential electrical system that provides power to equipment necessary for patient care, such as operating room lights and medical equipment. Article 517.19 covers the equipment system, which provides power to equipment that is not directly related to patient care, but is still essential for the operation of the healthcare facility, such as HVAC systems and computers. Article 517.20 focuses on the connection to alternate power sources. The transfer of power from the normal source to the alternate source must be automatic and occur within 10 seconds. This ensures that critical equipment continues to operate during a power outage. Article 517.21 covers the grounding of electrical equipment. All electrical equipment in patient care areas must be grounded to a common grounding point. This helps to minimize the risk of electrical shock hazards. Article 517.25 discusses the requirements for isolated power systems. Isolated power systems are used in critical care areas to reduce the risk of electrical shock hazards. These systems isolate the electrical supply from ground, preventing current from flowing through a person who comes into contact with a live conductor. Article 517.26 provides details on the line isolation monitor, which is a device that monitors the integrity of the isolated power system. The line isolation monitor alerts staff to any faults in the system, allowing them to take corrective action before a shock hazard occurs. Article 517.29 covers the requirements for low-voltage equipment and wiring. Low-voltage equipment and wiring must be installed in accordance with Chapter 7 of the NEC. Article 517.30 provides additional requirements for ambulatory care facilities. Ambulatory care facilities are those that provide medical care on an outpatient basis. These facilities must meet the same electrical safety requirements as other healthcare facilities. In summary, while Part Roman II of Article 517 does not apply to medical office buildings, doctors' offices, or dentists' offices where patient care activities do not involve electrical life support or invasive procedures, it is essential to consult the entire Article 517 and other applicable sections of the NEC to ensure electrical safety in healthcare facilities. These facilities should adhere to standard electrical safety practices and ensure that all electrical equipment is properly installed and maintained. Grounding and bonding are critical for preventing electrical shock hazards. Regular inspections and maintenance of electrical systems are essential for identifying and correcting any potential problems. Using hospital-grade receptacles and GFCI protection can further enhance electrical safety in patient care areas. In addition to the NEC, healthcare facilities must also comply with other applicable codes and standards, such as those established by the National Fire Protection Association, or NFPA, and the Joint Commission. These codes and standards provide additional guidance on fire safety, infection control, and other aspects of healthcare facility safety. It's crucial to stay up to date with the latest version of the NEC and other applicable codes and standards to ensure compliance and maintain a safe environment for patients and staff. Regular training for healthcare staff on electrical safety practices is also essential. This training should cover topics such as the proper use of electrical equipment, the recognition of electrical hazards, and the procedures to follow in the event of an electrical emergency. By implementing these measures, healthcare facilities can minimize the risk of electrical accidents and ensure the safety of patients, staff, and visitors. Remember that the AHA has the final say in the interpretation and application of the code, so it's always best to consult with them if you have any questions or concerns. In addition to the specific articles mentioned, several other sections of the NEC are relevant to electrical safety in healthcare facilities. Article 250 covers grounding and bonding requirements, which are critical for preventing electrical shock hazards. Article 300 addresses general wiring methods, including requirements for cable types, raceways, and enclosures. Article 406 covers receptacle requirements, including the use of tamper-resistant receptacles in pediatric locations. Article 517 provides specific requirements for essential electrical systems, including the types of equipment that must be connected to the system and the testing and maintenance requirements. Article 700 addresses emergency systems, which provide backup power for critical life safety equipment such as exit lighting and fire alarm systems. Article 701 covers legally required standby systems which provide backup power for equipment that is essential for the operation of the facility but is not directly related to life safety. When designing and installing electrical systems in healthcare facilities, it's important to consider the specific needs of the facility and the types of procedures that will be performed. For example, facilities that perform invasive procedures or use electrical life support equipment will require more stringent electrical safety measures than facilities that only provide routine medical care. It's also important to consider the potential for future expansion or renovation of the facility. Electrical systems should be designed to accommodate future growth and changes in technology. Regular inspections and testing of electrical systems are essential for ensuring that they are functioning properly and meeting all applicable codes and standards. Inspections should be performed by qualified electrical inspectors who are familiar with the requirements of the NEC and other applicable codes. Testing should be performed using calibrated test equipment to ensure accurate results. Any deficiencies identified during inspections or testing should be corrected promptly to prevent electrical hazards. In addition to following the NEC and other applicable codes and standards, healthcare facilities should also implement a comprehensive electrical safety program. This program should include written policies and procedures, regular training for staff, and ongoing monitoring of electrical systems. The electrical safety program should be reviewed and updated regularly to ensure that it remains effective and compliant with the latest codes and standards. By implementing a comprehensive electrical safety program, healthcare facilities can create a safe environment for patients, staff, and visitors, and minimize the risk of electrical accidents. It is important to emphasize that electrical safety is a shared responsibility. Everyone in the healthcare facility, from administrators to clinicians to maintenance staff, has a role to play in ensuring electrical safety. By working together and following the established procedures, we can create a safer environment for everyone. Remember to always consult the latest edition of the NEC and other applicable codes and standards, and to seek guidance from qualified electrical professionals when needed. Do not attempt to perform electrical work unless you are properly trained and qualified. Electricity can be dangerous, and improper work can lead to serious injury or death. Always prioritize safety and follow all established procedures. By following these guidelines, healthcare facilities can minimize the risk of electrical accidents and ensure the safety of patients, staff, and visitors.